A little bit
Nobody's
closer. A little bit closer.
Okay. Thank you, Thank you. Thank you, Senator Sanders, and members of this committee. My name's Ellen McInnes. I'm a nurse at St. Elizabeth's Medical Center in Boston. I've been there 26 years. For the first 12 years I worked at St. Elizabeth's, we were operated by the Archdiocese of Boston. And then Cerberus Capital came along, Stewart came along, and it's been downhill since then. We have 2,800 Massachusetts Nurses Association nurses and healthcare professionals working at Stewart hospitals. I'm proud and honored to be representing them today. We hope that we can provide a unique perspective on this issue because we are the front line providers. We provide more than 90% of the care delivered at Stewart hospitals. The corporatization and commodification of healthcare is the guiding ethos of Stewart. It's the one and only priority. And it has led to horrific suffering and harm to our patients, the people who take care of our patients, and our communities. The immediate and most debilitating impact of the ownership of Stewart was the Stewart's tendency to understaff units whenever and wherever they can. I spent 20 years working in the emergency department at St. Elizabeth's, and I can tell you we always struggled to have enough staff, enough equipment, enough supplies to keep our patients safe. Probably one of the biggest impacts is after a patient is admitted to the hospital, they end up sitting in the emergency department for hours to sometimes a couple of days because the units where they should be admitted and safely cared for are not staffed. This chronic understaffing has resulted in preventable harm and even death. The Boston Globe just ran a front-page expose highlighting some of the tragic consequences at Stewart hospitals. This included 2 patients at Holy Family Hospital in Methuen who died in the emergency department because they weren't immediately assessed and they weren't monitored, and that relates directly to severe understaffing of that department. At Good Samaritan, 2 patients died after spending hours in a significantly understaffed emergency department. One 81-year-old gentleman came in for chemotherapy for his pancreatic cancer, and by the time staff got to him, he was dead. There were 95 patients in that emergency department on that shift, and only 11 nurses. It is absurd to think that 11 nurses can care for that number of patients. At another Stewart hospital, sadly enough, a 28-year-old gentleman came in. He was in an acute mental health crisis. He was placed in restraints for his own safety, and there was nobody available to closely monitor him, which is what statute provides for. And when he went into distress, nobody was there to rescue him, and he's dead. All of these were preventable. We also have seen Stewart fail to provide the supplies and the equipment that we need. Either the supplies don't come through the front door because we're on a credit hold and nobody will bring them to us. Also, our equipment it's not properly maintained. We have IV pumps and computers with battery lives of 7 to 10 seconds because the maintenance just hasn't been done. During my time in the emergency department, I worked nights. There were nights that we didn't have any Similac or Pedialyte or even diapers. I can think of 2 separate occasions where staff went out in the middle of the night to a 24-hour store to get those supplies. Also, we frequently didn't have food, kitchens locked up. And I personally have given my dinner, my meals to patients, and staff has chipped in and sent out and had food brought in for patients. Sadly enough, sometimes babies die, newborn babies die, and the practice is to place the baby's remains in a bereavement box and take it to the morgue. Stewart didn't pay the vendor, and there weren't any bereavement boxes. And nurses were forced to put babies' remains in cardboard shipping boxes. These nurses put their own money together and went to Amazon and brought the bereavement boxes. Gosh, there's so much more to say. Probably the most tragic and what finally blew the lid off all this was the death of a 39-year-old woman who came to the hospital, had an absolutely normal childbirth, was bleeding. She may have been saved by a device known as an embolism coil. There weren't any in the hospital. There hadn't been any in the hospital for weeks. They had been repossessed by the vendor. She died. Stewart has also caused the closure of Quincy Medical Center. I grew up in Quincy. This was very close to my aunt. And now Neshoba and Kearney Hospital. Kearney Hospital sees more than 30,000 patients a year. Boston EMS takes 6,000 patients a year to Kearney Hospital. Where are they going to go? We don't have the capacity in Boston for this. I know we have a lot of hospitals. We also have a lot of patients. And just to be clear, we need not to let this happen again. And thank you for coming together. And it's my sincerest hope that you can put an end to this. Thank you.
Thank you very much. Ms. Spraken.